This is a very special day for us. We're thrilled to have you all here so that we can share with you some of the amazing things that are going on at Duke Sports Medicine, Duke University, and in the Durham community. I want to take a second first to thank our fellows. They've done a great job at putting together some of this day and the social last night, and as you saw, the conference this morning. Thank you, fellows. They're exhibiting the leadership characteristics that we find in our Duke Healthcare leadership model that are integral to our fellowship. They have patient-centeredness as their core principle, foundational competencies of integrity and selfless service. The framework, when you come to Duke for an amazing clinical experience, for the research opportunities and the opportunity to learn to be a teacher in orthopedic sports medicine. But more than that, you come here to learn to be a leader in orthopedics, in medicine, in sports medicine. And a big piece of that, of our program, is that we're preparing you for the leadership challenges that you will face. You'll be part of the Fagan Leadership Program, and I encourage you to go to the Fagan Leadership website to learn more about it. This is a truly amazing fellowship because it combines clinical research, education, and leadership, and there's nothing else like it in the world. We're very excited to have you here. We're very excited to talk about all the great things that are going on here, and we look forward to having a great day. Welcome to Duke.
I'm surprised you didn't write it. Hi, welcome to the Yo Training Room. This is where we take excellent care of our football players. We see a wide variety of injuries ranging from shoulder instability to ankle impingement to multi-leg knee injuries. Here you'll see our excellent facilities where our players will do the rehabilitation. And it essentially functions like a standalone clinic where we'll see our post-ops and pre-ops. Over here is the Jim Urbanek medical office, which is where the magic really happens. Let's go take a look.
Can you move on? I'm waiting for my 5 o'clock massage. Hi everyone, welcome to the Jim Urbanek Medical Office. This is where we do some of our preoperative and postoperative evaluations of our patients, as well as see some of our athletes pre-game, during the game, or after the game. Specifically, we're able to pull up their medical imaging and their charts here. We have a lot of supplies here to do pre-game injections, including Toradol injections and steroid injections. And then we also have a fluoroscopy machine over here in which we can do some during game fluoroscopic evaluations. And it really allows us to take care of our world-class athletes, like the best badminton player I know here, Dr. Chris Schultz, who we take excellent care of back here in the office.
Hey guys, just telling you a little bit about team coverage when you come here. So we cover the Duke teams as well as the NCCU teams. You guys will be helping out with football and basketball at Duke, as well as football at NCCU. We also cover all the Olympic sports teams here, so all the non-revenue sports as well. You guys are actively involved with that care. You guys are joining us in the training rooms, join us on the sidelines. You're also involved with all the injury reports and decision making of that. It's a great opportunity to travel and meet and get to know your faculty a little bit better, and also learning how to manage a training room and taking care of sports injuries. We're covering high schools as well when you're here, so where you will be the primary provider on the sidelines and managing the team and the training revenues and working athletic transfer at the high schools. So it's a great opportunity, and we make sure we get you guys heavily involved with it.
Hi, welcome to Duke's virtual training room tour for our fellows. The orthopedic fellows are very, very important to the Duke athletics, to Duke medicine, and to the athletic training staff. Our student athletes get to know them, they get to work with them, and they're an important part of the care for the Duke athlete.
Taking care of the Duke football is quite a tall task. Some of these responsibilities include running down this tunnel looking awesome and keeping Amendola from trying to take over the coaching positions here.
What he really means is trying not to get trampled while you're going down the tunnel, and once you get out there, making sure you bring 10 layers so you don't freeze your hands off.
Let's go take a look on the field.
Welcome to Brooks Field. This is where you'll get to help take care of the football team alongside our primary care sports medicine colleagues.
Here you'll get to watch fantastic games against powerhouse schools like Notre Dame and Clemson. And Caitlin here led the Duke football team to the most decisive victory of the season against the Charlotte Hornets.
Duke Sports Medicine, number one, is all about a bunch of heroes. We got the best people on the face of the earth here, and it's been a pleasure. I'm going into my 14th year of coaching at Duke. One of the very best champions are always going to be our physicians, our fellows, our people that become a part of our family. Duke football, Duke medicine.
I just want to spend a few minutes talking about our research enterprise here. And for the fellows, we work with you closely. We try to have some projects ready to get you guys kick-started, and also help you guys explore your interest and build your research projects. We have clinical research coordinators dedicated to the fellows. We have access to a biomechanics lab. If you're interested in anything about research, ask any of the faculty members and we can answer those questions for you.
Welcome to our Duke Basketball Athletic Training Room. This is where we get to work closely with our Duke basketball athletic trainers and physical therapists who take excellent care of the world-class athletes that come through here, many of whom are going to be future NBA champions. And so this is just a short walk down the hall from Cameron Stadium, which we'll go to next.
Oh, hey Holly, how are you? I'm just here getting my normal afternoon shots up. Welcome to Cameron Indoor, where the crazies go pretty wild right now.
This is where Dr. Amendola gets to sit during their basketball games. You may have seen him on television. Dr. Bytomsky is also around here just at the base of the net. You might see him muttering to himself or talking trash to the other team, but really the reason why he's right here under the net is so he's close to the action. He's right close to the team, which is going to be sitting over here to my right with Coach K and our cadre of athletic training and coaching staff. And in a regular season of basketball, as the sports medicine fellows, we would also be sitting down here with the team and the coaching staff. So it's a really awesome and close-up experience.
Hi, I'm Jocelyn Whitstein.
And I'm Cal Lassiter.
And we are part of the Sports Medicine Fellowship. We operate at Duke Raleigh Hospital.
And we do lots of different cases here. My particular area of interest is shoulder arthroplasty, reverse shoulder arthroplasty, and then a mix of general sports medicine cases, ACLs, a hip arthroscopy, rotator cuff repairs.
And my practice is more shoulder, knee, and elbow based, including arthroscopy of all those joints. I also see a fair number of pediatric conditions. We hope you're interested in our program and look forward to sharing more of this with you during the interview day.
I think we have a great hip experience in the fellowship. I'm 100% hip preservation, and that immersion allows us to be on the front end conceptually and technically. What really, I think, makes it a special hip experience is the ability to customize the second half of your fellowship. I feel like is one of the great strengths of the program. Allows you to get that in hip, but also not spend 3 months on it if you're never gonna do it again.
Welcome to the Duke Sports Science Institute Clinic. Here's where you're going to be spending a lot of your time. Let's go take a look inside. As you can see, it's a very nice clinic space. Nice floors, nice windows and natural lighting on a otherwise not so cloudy and dark day. Here's where we spend a lot of time with our primary care colleagues who work in adjacent pods. We'll often share patients, see patients together. On a different year, we bring you by to see the physical therapy building, which is just down the hall, and where quite often our therapists will come in a given clinic visit and even do a small session of therapy with some of our patients if they from far away or out of town and need to see a therapist sooner. Here we have all our supplies for injections in our closet here. We can do ultrasound guided injections. And it's really just a very pleasant place to work. There's a cast room, there's a cast tech working in here. And then probably the crown jewel of the whole facility would be the Starbucks coffee machine.
And here we are downstairs at the DSSI, coming this way, you'll see the gym downstairs here for the fellows and the rest of the staff here at DSSI. Welcome to the Michael Krzyzewski Human Performance Laboratory, also known as the K-Lab. Truly a unique resource here at Duke for our research enterprises with a Biodex machine and force plate, as well as full 360 high-speed motion cameras. It's really unmatched across the country and is really a tremendous resource from a research perspective for our fellows.
Just one of the many perks of being a fellow at Duke, you get COVID tested regularly, so you're always safe.
The operating room, we just finished the day. I just wanted to first of all, welcome you all to the Duke Fellowship interviews. This is our OR team today, and that's what this fellowship is all about, is team. I'm here to answer the question of why you should consider Duke as the place for your sports medicine fellowship training. Well, I think we have a great faculty. We have a large faculty, very diverse faculty that have been trained in many areas around the country so that you do get an appreciation to different approaches on how to manage sports medicine problems. In addition to the clinical and surgical training in sports medicine, this is a sports medicine program, so we do a lot of team coverage. You really get to see what team coverage is all about because you interact with the rest of the sports medicine team. Experts and how to optimize performance on the court and on the field, competitive to recreational athletes and then post-career athletes, and the traumatic effects of sports on joints. We do a lot of research in terms of clinical and basic research that you have exposure and the ability to get involved in. You're part of a orthopedic program with a very good orthopedic residency training program. So you really get a broad appreciation and excellent amount of interaction with people outside of the field of sports medicine, really that make you better all around. I think this is a comprehensive training program, and I really do hope that you consider coming to Duke and making this your place to train in sports medicine, become part of our Duke Sports Medicine family.
Well, I hope you enjoyed your visit at the Duke Sports Science Institute. Got to see basically a day in a life as an orthopedic fellow here. Good luck on your interview, and have a good rest of your day. Take me away.
Welcome to Duke. I'm Coach Mike Krzyzewski of the Duke men's basketball team, and I've been here for 40 years. So we have had an amazing relationship with the orthopedic team. They are there for us all the time. And for me personally, I have 2 hip replacements, 2 knee replacements, and it's all gone well. They make us better. They make us better because we're good and they're really good. And when you come, you'll get trained at the highest level. There's an education there that we will do to the highest level also. We will allow you to make us better while Duke is making you better. That's the way it is, and that's why you should come. I'm sorry you're not going to be here in person, but hopefully I'll be able to see you here in the future.